Hi, Rolda. We're wondering, since we're about to start, if we could get the main slide up. I know there was an intro slide that they were hoping to get ready. Thank you.
Okay, you are there. Exactly.
David, I'm glad you got in. I was just writing back to your email.
Welcome, David.
Thank you.
And morning, everyone. So for the speakers, as attendees are coming in, we are asking that they put their cameras on just for the time that they're speaking. It doesn't have to be more than that, so we can conserve bandwidth, but just to engage the audience a little bit. And I see people are rolling in from the other sessions now, so we can start shortly.
I let them.
Hey, good morning.
I am trying to get on, but it says that I have to wait the host to let me open my camera.
I'm not quite sure how to fix that. Maybe roll the know how to make that update. If we can't get it working, that's okay too. It's not a huge deal.
Okay, no problem.
Okay, we'll get started in a moment. Okay, welcome everyone. I see people are still trickling in, but Allison, maybe we could go ahead and get started with this session. I'll just add a few reminders at the top. Everyone can feel free to enter their name, organization, and country they live in or they're working in into the chat pod. You will have to hit the drop down and switch it from all panelists to all panelists and attendees for everyone to see what you're writing. Please feel free to do that. Yeah, I think with that, I will turn it over to Allison, and keep your eyes on the chat, and we'll be putting updates and questions there. Thank you.
Okay, great. Thank you, Latham. And welcome all to the local partners meeting PrEP panel. We are so thrilled to have you here with us today. My name is Allison Kimmel, and I am a biomedical prevention advisor with OHA, focusing mainly on PrEP. And I'm really honored to be the moderator of this session. We have 3 excellent panelists that will showcase their organization's work. Joanne Etienne from Fondation Cerave in Haiti, and Dalkacho Dorese from Project Hope Namibia, and David Mutinda from Ampath Plus in Kenya. And I thought I would first open with just a few words on PrEP and USAID's PrEP program in particular. And then each of the panelists will share their presentation. Before each presentation, I will introduce the panelists, and then after the third panelist, we'll hopefully have at least 20 minutes for a spirited discussion. So I and Latham will be monitoring the chat boxes for questions. Please type in your questions to the chat box and make sure to select to all panelists and attendees as you enter the chat. And we will attempt to get to as many questions as possible at the end. Next slide, please. Thank you. So this was a big year for PrEP. We saw more evidence coming out of research trials showing the impact that PrEP can have, a few of which are shown on this slide. In particular, the ECHO trial in Eswatini, Kenya, South Africa, and Zambia found that just a 25% uptake of PrEP by women in the ECHO study produced a more than 50% fall in the rate of HIV infection in all study participants, whether they took PrEP or not. The SEARCH study, which offered universal access with same-day or rapid PrEP start in 16 communities in Kenya and Uganda, found that this population-level PrEP was associated with a 74% reduction in HIV incidence. 83% of participants who initiated PrEP stopped PrEP at some point, but 50% of these participants later restarted. And of participants that reported current HIV risk at follow-up, 90% received PrEP refills and over 70% self-reported adherence. So results from these studies show that individuals take PrEP when they see themselves at risk and not at other times, and that people can adjust their PrEP use according to their seasons of risk. And that even with imperfect use, PrEP can have a significant population level impact. And we see that where PrEP is introduced at a large scale, there's a big impact on new HIV infections. Next slide, please. So at USAID, we focused FY20 on expanding and building momentum from the previous year, and looking forward into FY21, we are significantly scaling up PrEP programs. In FY19, USAID overachieved with over 88,000 PrEP initiations. In FY20, at the end of Q2, USAID was on its way to reaching its goal of over 155,000 new PrEP initiations. And in our new COP year, FY21, we are significantly scaling up to initiate over 543,000 new individuals on PrEP. Next slide. So to accelerate into COP20, we are focusing on each of these components on the slides, and I'll just highlight a few. We're moving from 22 countries to 31 countries implementing PrEP. We're working on national policies that move beyond focus populations and are more inclusive. We're expanding provider trainings, including through virtual methods, and we're taking lessons learned and expanding those to other countries and contexts. Next slide. So looking forward into COP20 and looking right now as COP20 has begun, significant effort will be needed to reach these ambitious targets, but we've seen in the past year, especially during the COVID-19 pandemic, that partners have really adapted and led the way. And identifying and scaling up successful innovations, such as decentralized PrEP delivery and the strategies shared today, will be key to PrEP acceleration. So with those few words, I'm going to now turn it over to our first panelist. As a reminder, please enter your questions and comments into the chat, and we'll have a discussion following all of the presentations. And then just as a gentle reminder to our panelists, please try to stick to the 10 minutes each so we have plenty of time to discuss as a group. So first, I'm very happy to introduce Joanne Etienne from Fondation Cerveau in Haiti. Joanne is a health professional with a medical background who has been working in health projects and program development and implementation for 12 years. For the past 4 years, she's been working as a key populations expert in Haiti, supporting the Ministry of Health in designing health interventions adapted to key population needs. So without further ado, Joanne, the stage is yours.
Thank you, Alison. Hi, everyone. I'm pleased to share with you Fondation Cerveau revolutionary strategy to increase PrEP uptake among key population in Haiti. Next. So when the Ministry of Health in Haiti launched the PrEP in March 2019 in the West Department, it was very challenging because to find the adapted way to promote PrEP counseling, to really promote the strategy among key population was very challenging. So you can see that as of March 2020, the total number of current PrEP users was only 287. So Fondation Cerveau in June 2020 introduced this revolutionary approach to increase PrEP uptake among key population, which is the PrEP champion. So the strategy has been implemented in three Fondation Cerveau clinics where PrEP service is available. Next, please. So how this strategy works. It's an incentive-based strategy that uses PrEP users to sensitize and promote PrEP uptake among peers that are at risk for HIV from their sexual and social network. So a PrEP champion is a key population, of course, an influencer who has been an active PrEP user for 6 months at least, motivated and committed to sensitize and bring at least 10 peers to the clinic per week. So the PrEP champion is identified among the clinic's PrEP cohort and is contacted by phone to be briefed on the strategy and its main objective. And the interested PrEP users come to the clinic and are oriented on the by the health providers on the PrEP champion strategy, on the PrEP key messages, and also they receive some flyers to distribute among their network. And the PrEP champion sensitize, of course, and bring their peers to the clinic to get tested for HIV. And for each peer enrolled successfully on PrEP, the PrEP champion gets an incentive of $2.5 US. Next. So this slide shows the impact of this strategy in a short period of time. So from the beginning in March, you can see the progression, the monthly progression of the strategy, you know. So at the beginning, it was very low, okay? And starting in June, when we introduced the strategy, you can see a huge difference between the numbers. So in June, we were at 686, and it went increasing, you know, significantly until reach a total number of 1,482 PrEP users at the end of August 20. Next, please. So what lesson that have we learned? It is effectively difficult to really design, you know, strategies that fit and meet the key population needs, especially in Haiti, given their problematic context. But the peer-based approach has shown that it has given many results, you know, and the PrEP champion is one of the best examples that show that is an effective way to reach the population. And also it promotes community engagement and ownership as it involves directly the targeted groups in promoting HIV prevention methods that fits their needs. Next. And as conclusion, in Haiti, PrEP targets female sex workers and men who have sex with men, both key populations. So the demand creation for PrEP was very low despite the facility-based and or community-based strategies implemented by health providers to promote the service among key populations. With the PrEP champion strategy, PrEP uptake increased. Information on PrEP is spread in the community, and key population from untapped network are reached also and sensitized on PrEP. So for the next steps, of course, the CP2 project managed by Fondation Serovi will continue implementing the PrEP champion strategy and plan its expansion to the rest of its network. So thank you everyone for your attention. Over to you, Alison.
Thank you very much, Joanne. Thank you for the great presentation, and it's exciting to see the success that you have had with the PrEP champion model. And we'll save any questions or comments to the end, and we'll keep moving along to our second panelist. It is my pleasure to introduce our second panelist, Dr. Ndelkacho Durese from Project Hope in Namibia. He is a medical doctor with a specialty in internal medicine. He's been working in the field of health and HIV and AIDS programs for the last 20 years. And currently he is working as a senior technical director for the Namibia Dreams Project, led by Project Hope Namibia. Ndelkacho, over to you. Thank you.
Thank you, Alison. I'm going to present the PrEP approach for the Namibia Dreams Project on behalf of the consortium members. Our Namibia Dreams Project is PEPFAR funded through USAID. It's a 5 years project, and we are on the third, we just started our third year implementation. And our goal is to avert a new HIV infection among adolescent girls and young women. And our target population for the Dreams projects are AGYW 2024, as well as their parents, caregivers, and sexual partners. We are implementing this project in 3 regions and 5 subnational units, Windhoek being the capital city of Namibia, Inoshikoto and Kazambezi. This project is implemented by Project of Namibia as a prime in collaboration with Star for Life, IntraHealth International, Lifeline Childline, Namibia University of Science and Technology, and Project of US. IntraHealth International is our clinical partner. Next slide. DREAMS is, as you know, it's a complex project, and it has a core intervention package. And the core principle of DREAMS is layering of interventions is really the key approach. And this, the slide you are saying, is like the Namibia DREAMS project layering table, where we provide primary, secondary, and contextual interventions. Primary interventions are interventions basically provided to all adolescent girls and young women in an age group if they are eligible for DREAMS. And secondary interventions are basically need-based, and contextual interventions are part of the DREAMS core package, but cannot be linked to an individual AGYW. So as you can see, our focus for PrEP is adolescent girls and young women between the age of 15 to 24 years. Next slide. So in terms of our service delivery model, we are basically using a flexible service delivery approach where we are mixing a health facility plus a community type of approach. In the health facility approach, we have what we call use-friendly rooms. These are basically designated rooms for adolescent girls and young women to receive an integrated service. And we are in that designated room, we are trying to make it a space use-friendly. We are innovating them, it's clearly labeled, and in areas where there is no room, we are also putting together prefabs. The service providers are mainly young nurses. They are trained on adolescent-friendly health services. We are essentially providing integrated health services, and there is a strong linkage between community. And in terms of AGYW participation, we have introduced suggestion boxes, and soon we are also going to introduce DREAMS ambassadors. This facility-based service is linked with a community platform where we have a safe spaces. Safe spaces are places where girls 10 to 13 number, on average 18, they meet on a weekly basis, and they attend to HIV prevention, GBV prevention, as well as social health building sessions. On those platforms also, as an outreach service, we bring all the clinical services, including PrEP. So there is a strong referral linkage between the facility and the community. And we also provide PrEP during HIV prevention education sessions in the community, as well as we also arrange drop-off for refill, particularly at a convenient place in the community for the girl. And at times also we might go to the household to deliver if the girl is comfortable and it's a safe environment for her. Next slide. This is just a slide to show you our scale up in terms of community-based PrEP. Initially, we were entirely confined to the facility, but as time goes on, we significantly scaled our PrEP delivery in the community. As you know, in March 17, a state of emergency was declared due to COVID-19, and since then the proportion has declined a bit, but in absolute numbers still we are providing a significant number in the community. Next slide. Our demand creation strategy, we actively screen all girls in all DREAMS entry points. We educate them on PrEP as part of the safe space education, as well as the health facility talk. We have IC materials, posters, flyers, and also during the COVID-19, we really used phone call to really to create demand, which really worked well actually. We also integrated PrEP as part of post-parenting skills for caregivers and also as part of male engagement session for the sexual partners of the girls. And those platforms, our nurses go out on a regular basis and they provide education on PrEP. We did this because one of the barriers for uptake of PrEP among girls was influence from parents and sexual partners. And we do also sensitize healthcare providers, which are not necessarily DREAMS staffs, and teachers on PrEP, because we found some non-DREAMS healthcare providers were discouraging girls to take PrEP. Teachers were also discouraging girls to take PrEP. So with that intervention, we showed progress. In terms of a work in progress, soon we will introduce DREAMS ambassadors. It's just like the champion approach. For as an advocate and as a supporter for DREAMS PrEP initiation. We have already done the TOT training. We are in the process of recruiting DREAMS ambassadors. Soon the implementation will start. We are also going to introduce PrEP as part of the government regular meeting platforms. And we are also working towards a local radio program and short video clips to really increase demand for PrEP. Next slide. These are like our PrEP implementation resources. We have eligibility screening tool. We are using the national guideline. We have a DREAMS adapted PrEP flow chart, and we also do routine screening for GBV in all PrEP delivery sites. Next slide. This is just to show you the PrEP Cascade from October 2019 to June 2020 of all the sexually active girls in the age group of 15 to 24. Close 64% were at substantial risk for HIV. Of those, 7 were already positive, they don't need PrEP, and 4,353 were HIV negative. And of those, 68% initiated on PrEP. Still, you can see here, you can see drop-off along the cascade. 68%, we have improved over time, but still there is a long way to go. There are girls who are, for example, 164 girls, they explicitly mentioned to us they don't want to initiate PrEP because they don't want to take daily pills. So they suggested they will come back when we have the injections. So that's just one to show you. And we had so far, since the start of the project, 3 seroconversions. Next slide. This is just to show you our performance over time from January 2019 to June 2020. You can see we have progressively scaled up PrEP initiation. By the end of Q3, we had 4,486 unique girls who were initiated on PrEP since the start of the project. This graph shows from January 2019 to June 2020. You might be wondering, there is a significant increase from Q1 of this year to Q2 of this year. One of the reasons is because we expanded our geographic coverage for DREAMS, and also we increased the number of user-friendly sites. We increased also dramatically our safe spaces. And also we scaled up really routine screening for HIV risk in all entry points. Those are the major reasons for the sharp increase. Next slide. So in terms of the lesson learned and major challenges, measuring success in PrEP initiation and continuation is a challenge because yes, we succeeded significantly in terms of initiating a lot of girls on PrEP, but we have a big challenge in terms of retention or continuation on PrEP. but is that really a failure of the program or is it something else? So to answer that, we did really went back to the girls who discontinued PrEP. We interviewed 374 girls, and a significant proportion of them, they discontinued PrEP because they feel they are no more at substantial risk for HIV, basically. And then the other proportion of girls, they also mentioned they self-transferred out. Of the 374, 39%, they said they are no longer at substantial risk for HIV, and 12% they self-transferred out. When you look at this, over 50% of them, they look to have a valid reason. So it might not show a program which is not successful, rather it could be successful, but this needs further study and discussion. Another challenge is scaling up community PrEP. You know, Namibia, it's a wildly dispersed population and distance is a challenge. Really delivering PrEP in the facility is a huge challenge, and that's why we opted for community PrEP service delivery. But with COVID, it starts becoming a challenge. As I mentioned, daily taking of pills is a challenge, but with a vaginal ring and with upcoming studies on injection, this issue can be tackled. And packaging of the PrEP medicine, because there is still stigma attached to ARV drugs. So the girls, they don't want really to use the same packaging of ARV medicines. Currently we introduce PrEP pill bags where the girls can put their pill bottles into those boxes. These pill bags are made by our own girls, the DREAMS girls. So we'll see how it will affect, but there is a discussion with the PrEP TWD to engage the national teams to consider about packaging. The stigma I have already mentioned. Yes, we have IEC materials, but still, is it really engaging, informative, and appealing to the girls is another question. And the other issue is optimizing frequency of PrEP refill visits. We understand, particularly with COVID, we need to use multi-month prescription. But if you really space widely the frequency of visit for girls, it's also a challenge for retention. And the studies have shown girls with less frequent visits, they are less retained. So where is the balance is also a challenge, particularly for the DREAMS project. Thank you very much.
Thank you so much, Ndalkucho. That was such a wonderful presentation, and I particularly found your last slide on lessons learned and major challenges to be very insightful. And I see some questions are coming in through the chat, and I just want to encourage attendees to keep questions and comments coming, and hopefully we'll have about 20 minutes to have a great discussion about what we have seen here today. So we'll wrap up our presentations with our final panelist, David Mutinda from Ampath Plus in Kenya. David is the HIV testing services and prevention technical advisor for Ampath Plus. David supports 10 counties in the western region of Kenya where Ampath Plus operates. And David has been in HIV programming for 14 years in various capacities in Kenya. So David, over to you.
Thank you, Alison. As you said, my name is David, supporting HTS and also prevention in Western region. I'm going to present PrEP implementation in Kenya, sharing an experience of Ampath Plus as a program. Ampath Plus is a local implementing partner funded by USAID and working closely with Moi Teaching and Referral Hospital, the second largest referral facility in Kenya, and also working closely with Moi University, covering 10 counties in the Western region. And therefore, we are working closely with the Ministry of Health just to be able to support them, to be able to implement the services and strengthen what the MOH is doing. Can you go to the next slide? So Kenya has had great successes in PrEP implementation. We have PrEP being integrated in national guidelines, and also has been rolled out as a national program as well. This diagram here shows the first steps that were implemented by the country towards getting the results that the country is achieving now. You can see from 2016, there was launch of ART guideline that actually integrated PrEP in it. MOH has been working closely with implementing partners, and Ampath Plus, supporting 10 counties, has been participating fully in the implementation and also in setting up the PrEP implementation. as well as forming TWG at national level and also subcommittees. Something to mention about the subcommittees that worked well for the country is setting up committees like monitoring and evaluation to help in reporting and also advocacy and also communication, just to be sure that the information is getting to the population knows what is expected of them, and also knowing what the importance of PrEP. And in May 2017, the national launch for PrEP was done, and we've seen a lot of results beyond that launch. Actually, that marked now the beginning and the full scale up of PrEP services in the country. We can go to the next slide. These are the key policy documents that the country has implemented to guide PrEP implementation. As mentioned earlier, we have ART guideline, version 2018, that fully integrated PrEP in it, and guiding providers on how to use PrEP and how to give PrEP out to clients. And we're also seeing the toolkit that is guiding also providers also in PrEP provision, as well as the roadmap that is helping the country to be able to monitor the performance of PrEP as well as implementation of PrEP services in the country. And go to the next one. Talking about AMBER Plus performance in FY20, these are the targets that were given to the program by USAID. And by August this year, the achievement was 162%, again is the target of 2029. The blue bar is the targets and the green bar is the achievement. And this one is not inclusive of September data, meaning that the achievement is going to be higher than the 162 for PrEP new. And the PrEP current, we're talking about 126% achievement against a target of 2,548 in the Western region that we are supporting. Let's go to the next one. Characterizing the patients the class that we put on PrEP, serodiscordant couples are taking the big percentage, with 94% in PrEP new and 93% in PrEP current. And other populations are also contributing to these numbers. Remember, we're talking about 3,199 in the previous slide. And we can see the female sex workers contributing 4% in PrEP new and 3.3% in PrEP current. MSMs are also contributing numbers, and they've been rich with success as well as transgender. And these are populations that have benefited from the PrEP success that the program has offered in the region. The next slide. This is a breakdown of PrEP new performance by county. In FY19, the program reached out to 2,410 persons with PrEP services and initiated them on PrEP. And in FY20, as I said, up to August, without September data, we've been able to achieve 3,286, achievement of 162%. You can note the growth in numbers comparing FY19 and FY20, a growth of around 900 people put on PrEP, growing from 2,410 to 3,286, and that number will be higher in September. And go to the next one. Next slide, please. This is now for PrEP current. In FY19, the achievement was 3,669, and in FY20 up to August, 3,199. And to note here is in FY20, this is where COVID came, and there were some challenges in retaining PrEP clients, but we happy that the program, we were able to put in strategies to be able to call patients, clients to come and actually pick their PrEP drugs. And that's why we kept the numbers still high despite COVID being with us for that period of 6 months. The numbers still maintained. Looking at this slide again, Kakamega, a county in the region that we are supporting, had great performance with over 1,000 plants on PrEP. Counties like Busia and also Bungoma growing in the numbers as well and reaching more people with PrEP services. And go to the next one. As you know, men are difficult to reach with services. When you look at this slide, at our program level, we count this as a big success. Reaching men, men is the green bar and female is the blue bar. Reaching men with PrEP services was a success. If you look at across the counties, we're having good numbers reached with PrEP for men, and this is across all the counties. Looking at the numbers actually means that a PrEP implementation is possible if you use the right strategies to be able to reach the right population. Then you are going to break and reduce the HIV infection in the region and also in the country. The next one. For PrEP current, similar numbers as well in terms of reaching more men and keeping them in treatment on PrEP drugs across the counties. Also numbers that are indicating that men can be maintained and that they can continue taking PrEP services as well. The next slide. So what worked for the program? We want to share the successes that we achieved and what we did to be able to get the numbers that we just seen. In this slide, we say that we improved advocacy systems in the countries that we are supporting. And this is not only starting the program, but it started with the national program as well. In this slide, you can see a Swahili word known as dependent, PrEP, meaning depend is a Swahili word that means love yourself and take PrEP to be able to protect yourself. And this has been a campaign and actually an advocacy that has been going on, and therefore the program built on that to be able to reach more people with the services, and therefore we improved our advocacy systems at the facility and also community level. In the facility, we intensified health talks, being able to reach all the patients that are coming to the facilities at all service delivery points with PrEP information, as well as community levels. In community, even with COVID and why we've been able to achieve those numbers, is providing PPEs, of course, with support from USAID, providing PPEs to the community health volunteers to be able to reach the right population out there. And also another population that we've been able to reach is the motorcycle riders, known as a local word, border riders, to be able to reach them, and most of them are men with the services. And also using patient support groups to be able to encourage the index plans to be able to talk to their sexual partners, to have them tested, and the ones that are testing negative then are also put on PrEP immediately, and that is connecting to the index testing, which has been very useful in reaching the negative partners as well. Can go to the next one. A continuation. AMBAT Plus is not working in isolation, but we are working to strengthen Ministry of Health systems. And that's why in our implementation, we've been working closely with the Ministry of Health in doing joint support supervisions. We're having routine support supervisions weekly and monthly and also quarterly. And in this case, we integrated PrEP in our routine support supervision visits to the health facilities to be able to mentor the staff, to be able to continue training the staff. One of the key things that affects PrEP implementation is when the staff doing the provision of PrEP are do not have the right knowledge and do not have the right attitude. They don't know why people are being put on PrEP. And this is something that we've done as a program to be able to educate and also train more people and the service providers to be able to provide that. And that has been very key for our success as well. In terms of task shifting, PrEP in our program is not a one department responsibility. It has become a responsibility of everyone. And that's why we are talking about provision of PrEP services across all delivery points, from the OPD, from the inpatient, from the MCH, and all the other departments. And therefore, each person is playing a role, be it a peer educator, be it an HTS provider, be it whoever is in the facility. He has a task of talking to the clients about PrEP and encouraging them, as long as they have a risk and a continuous risk, to be able to take PrEP as well. Here we are picking out HTS providers who have been playing a key role, because we are doing optimization of HTS services in the OPD, where we're having a lot of visits of clients. And therefore, when we integrate PrEP in it, then we're able to reach more populations and we're able to offer more services, PrEP services to a greater number. And then extended hours. I said earlier, men are not easily reached with the services, and most of them in our region don't go to the facilities. And therefore, we decided to extend working hours beyond the normal working hours, just to ensure that men who are not comfortable coming during working hours to pick PrEP drugs can be able to come in the evening, as well as weekends, so that we can have, even the young people are not able to come during the day, they can be able to come in the evenings. Go to the next one. Then also strengthening reporting system, MOH reporting systems, to ensure that we're not missing on the data that we are getting, and we're able to use the same data to make decisions. We're encouraging the facilities and also the sub-county levels as well as county levels to be able to look at their data, have data reviews. As they look at first 90, as they look at the other 90s, Then they also look at PrEP provision and where are they in terms of performance, and they can be able to see who have we reached, who have we not reached, and then they can be able to reach them with the right services. That has really worked for the program as well. The next slide. Of course, in implementation, you get challenges when you're running your implementation, and key challenges that we picked that we're working on, and some of them we've been able to overcome. Just to mention a few, stigma associated with ARVs. People believing that I'm not HIV positive, why am I taking ARVs? And also fear of side effects. Of course, when we're doing education, talking to the people, and they know that there are side effects that are coming. Some people say no to the PrEP drugs, and also some drop because of getting side effects when they start taking the medication as well. And then there's low perception of HIV risk. It takes actually an effort to convince someone who is HIV negative to be able to take up ARVs, and therefore that has been a challenge, but we are seeing more growth of more people accepting the services. System related, we are building capacity of the providers every day, and as we get more people coming on board, as we continue talking to them in the CMEs, we are able to overcome that challenge. And then finally, it's about electronic data collection. We are using some of the facilities that we are supporting are using manual data collection and reporting, and we're working with the ministry to be able to strengthen their system as well, to be able to report the data, to be able to collect the data, and also report the data electronically to make quick decisions in the implementation. Next slide, please. We're also encouraging couple counseling and testing where possible, so that in case someone tests positive, one of the people tests positive, then it is easy now to initiate them on PrEP, and also continuation of demonstration of drugs on how they are being used and what why they're important as well. And then finally, as a program, one thing that we're believing in, and this has worked for us, is encouraging everyone to be able to share about their HIV status, and not the status of the other person. If it's negative, then they need to be put on PrEP. Thank you very much, and over to you, Alison.
Okay, thank you all very much. This is Latham, and we have a few questions, and then I'll turn it back over to Allison. So the first question is for Joanne, and we were wondering what were the key messages that the PrEP champions take into the community? If you could talk a little bit about that would be great. Thank you.
Yeah, sure. So the key messages is regarding, you know, how to stay HIV negative. Okay. So first of all, what is HIV and how you can contract HIV and how you can stay away from HIV. So basically this is the message. And also where you can find PrEP, okay, the PrEP service. So there is a list of clinics with their address and a phone number where the peer can go directly or contact by phone and get the information on PrEP. You know, what is PrEP and how I can access the service, what do I need, or is there any requirement to access the service. And there's also a hotline that is free that any peer, any key population can access to get information on PrEP. So yeah, so this is basically what we provide as information. We try to be as much concise as possible, you know, to avoid confusion or any misunderstanding regarding what is PrEP. And then when the peer goes to the facility and meet with the healthcare provider, he gets more information in a clear and concise manner, so they can understand better and really and get engaged when they access the service, and ensure that they are taking the pills properly, you know. And the counseling also is adapted to the individual to ensure that they stay on PrEP, and if there is any issues regarding how they're taking the medication, if there is any side effect. So they are, the peer educators also trained to support the client, you know, the peers that are using PrEP as a preventive method. Thank you.
Thank you very much. Interesting. And so our next question is for Ndalkachu from Annalise. It's a two-parter. The first part is who initiates PrEP in the safe spaces, and the second part is were there any barriers or challenges in moving from facility to community-based initiation? So, Ndalkachi.
Okay, thank you. The ones who are initiating PrEP in safe spaces as well as in the facility are trained nurses who are professionals, and they are trained on PrEP as per the national guideline. So those are the ones who are providing PrEP. But in terms of screening, following up to remind appointment, tracing if they discontinued PrEP, the mentors to the girls are also actively engaged. But the actual PrEP service delivery is done by the nurses. In moving from a facility to community for PrEP service delivery, normally we do it on a scheduled visit to safe spaces. So the safe spaces are happening every week, and the nurses are visiting the safe spaces once in a month. So I think the biggest challenge is that if you don't have a continuous safe space activity, that will be one of the challenges to deliver PrEP services on a regular basis to those safe spaces. For example, because of the COVID-19, during the lockdown period, almost all safe spaces were stopped. So we have to opt to either the girls to bring them to the facility, or we need to go to a household or to a convenient place to a couple of girls instead of like multiple girls, which can easily be reached in a safe space. So that has been like the biggest challenge. But once we have an active safe space running regularly, the community PrEP service delivery is not really a big challenge from the experience we have so far.
Okay, thank you. And actually, there's one more follow-up for you, Ndalkachi, and then we have a question for David. But they were asking if you could provide some other examples of eligible but not initiated, aside from refused.
Okay, thank you. I think one of the main reasons I showed the cascade is, yes, we are achieving our target for FY20, but we just don't limit ourselves to the target. We always see who are eligible and who are provided beyond comparing it against target. And one of the biggest challenges we had was a limited human resource. So we had a limited nurses, and also there was a high turnover rate in terms of our nurses. So it's mainly a lack of human resource, which means we didn't offer them the PrEP. We screened them, but we didn't necessarily offer them because of the limited human resource. The other reason is we might have offered the service to them, but the outcome was not documented in our tools. So those are the main reasons for not eligible but not provided.
Okay, thank you. So now a question for David. We're wondering what it is that you think made your program so successful in reaching men. If you could talk a little bit about that.
Thank you for that. One of the things that we used is the community approach. And in community approach, we used there are populations that almost general population, yes, but we've not been reached with services. So we did what I called border riders, and actually approaching them and talking about PrEP to them and referring them to the facilities. Border means motorcycle riders. And also in addition to that, we were also able to categorize our discordant couples and did line lists for the discordant couples. And we were able to follow. When you look at the data, for example, for Kenya, we have more women in care compared to men, and therefore we talk to the women and encourage them to have their partners tested. We reached out to the partners, and the ones that we tested, if you look at the discordant couples, contributed around 94%. Therefore, we were able to reach the partners and have them tested as well. And also the extended hours, people coming to the facility very late in the evening, and then they're able to be kept on treatment on PrEP for a longer period compared to if they were to come during working hours, then we would have lost them, but we were able to keep them. But I think keenly is about the discordant couples and being able to line this and follow the partners and have them tested, who mostly are men. Thank you. Okay,
thank you. So another general question, and this could be for anyone on the panel, but you've each shared examples of successful strategies. How do you think that you'll adapt as you move into the new COP year and scale up your PrEP? So could be for any one of the three panelists. Question about adapting and scaling up for the new copier.
Okay, maybe I can start from our perspective. I think in terms of adapting and scale up for this year already we have started it. Basically, our target is 20% higher, 22% higher than the FY20 target. So one of the things we are thinking is one, as I already mentioned, one of the challenges is human resource. So we have already started to recruit nurses who can serve us because we are moving toward the saturation. So we are significantly scaling up our community safe space activity. We are also expanding our use-friendly clinics, including use-friendly rooms, including putting together more prefabs. That's one strategy. I think the second thing we are thinking, particularly in the face of COVID, the virtual demand creation, I think we need to think more about that. The phone call has really worked for us in the past 2 quarters. So we are thinking to really scale up the virtual demand creation approach. And basically also we are revisiting our demand creation strategies and IEC materials so that they can be friendly and not stigmatizing the girls and not talking about really more on specifically HIV risk so that they will not be stigmatized, rather more focused on vulnerabilities, something appealing to the girls. That's one thing we are thinking really in terms of scaling up PrEP intervention, and we'll continue also to scale up our community PrEP service delivery because distance has been a challenge for girls to come, particularly for refill. So really scaling up community PrEP service will also help us to increase our interventions and reach.
I can also go second. In terms of scaling up PrEP uptake in our region, we're looking at 3 things. Number 1 is intensifying the community approach. It's something that we're thinking we've not maximized, we've not done it optimally, and therefore being able to reach the general population. If you look at the data that we shared, 94% is from discordant couples, meaning we still have some more people that we can be able to reach out and be able to get out there. And therefore we want to be able to get strategies on reaching the community with more with PrEP services and be able to get even general population people at risk on PrEP. Secondly, it's about the key population. We're still feeling that we still have some work to do on the key population bit to be able to reach more with those services and do more advocacy in terms of getting messages to them and have them buy in and also be able to access more PrEP services. And then the other thing is about capacity building on daily basis. Let's talk about it. Let's encourage our people to know why we are doing we're offering PrEP to people and have them take up the PrEP services as well. And finally, it's about the service delivery points in the facilities. In all the facilities, even the ones that are not having staff, program staff, scaling it up and talking to the Ministry of Health staff also to be able to scale up PrEP in all the service delivery points. That will also improve our performance for the COP20. Thank you.
Okay, great.
Sorry, can I go on?
Yeah, please. I'd love that.
So for Haiti, we will focus on the retention side of the PrEP. Of course, we have a lot of people. The uptake has been increased, of course, but also we want to really focus on the engagement of the peers when they are on PrEP, why they're on PrEP, and they have to stay on PrEP. I mean, of course, it is their choice, but we want to focus on that also. So we are thinking of a strategy, which is the discussion group for PrEP users. As for patient, we have support group. So for PrEP, we will have discussion group. So this space will give them the opportunity to discuss the challenges they are facing with PrEP, and also they will get also the support of the healthcare provider, especially the social worker and the peer educators that are also, be there to support the peers on the PrEP.
Wonderful, thank you. Also, John. So we have 4 minutes left. I want to quickly turn it back over to Allison to discuss takeaways. Allison?
Great, thank you, Latham. And thank you to each of the panelists for your very excellent presentations and the discussion as well. Thank you to the participants for your comments and questions. One of the things we want to be sure to capture in these sessions is some key takeaways from the session from both panelists and attendees. I know a big takeaway from me is that tailoring PrEP services to your clients, and we say this all the time, but meeting people where they are at, especially during COVID, when we're trying to decongest health facilities, move or scale up PrEP into the community and use virtual methods for demand creation and service delivery. So I thought I would turn back to the panelists, but also attendees, please feel free to type in any key takeaways that you have from the session into the chat. But I'll start with the panelists and just ask you, what's a key takeaway that you are taking with you from this session today? And I'm sorry to put you on the spot, but perhaps I'll first start with David. Is there one key takeaway that that will stay with you after this session, or perhaps that you hope attendees take with them?
Thank you, Alison. Two things. Listening to the presentation that has been done by the three panelists, it's clear that PrEP is not one person's responsibility. It is a responsibility of all of us to be able to roll it out, to be able to offer PrEP to everyone and ensure that we are able to reduce HIV infections. So I think my key take-home message is that PrEP is a responsibility of everyone where we are, and we can lead from where we are. My second one is that PrEP can also target general population, not only the populations, the few populations, but also you can be able to reach out to many and have them put on PrEP to reduce the HIV infection. Thank you.
Thank you, David. I love that. I love the PrEP isn't one person's responsibility. It is the responsibility of everyone. And now perhaps I'll turn to Ndalkacho. Is there a key takeaway that you have found from the sessions today?
I think from the three presentations, we have seen that it's not that challenging to scale up PrEP initiation, but I think the biggest challenge ahead of us is really how do we ensure continuation of PrEP intake? What are the researches on the pipeline? What can be done, particularly for the difficult group like adolescent girls and young women? And the idea of engaging them as champions or ambassadors might be key moving forward, particularly in terms of PrEP continuation.
Thank you. Such an important point, I think, about how do we ensure PrEP continuation and effective use, make sure that we are supporting people, especially groups like AGYW, to use PrEP when they want and need to use PrEP. I'll now turn to Joanne. Is there a key takeaway from today's session that you could share with us?
Yeah, as we all know, when we are designing programs for any targeted groups, it is very important that they also participate in what we are proposing them, to ensure that they really get engaged and they own, at the end, this program or project that is designed to serve them. And other thing is that the challenges that, of course, any project is faced, throughout its implementation. It's not only can be served as a lesson learned to really scale up and improve, the quality of the project, but also it can serve to increase, any other strategies that we didn't have in mind at the beginning, and can improve at the end what we have in plans for those targeted groups. Thank you.
Thank you so much, Joanne. And again, just thank you to the panelists for sharing the very good work each of your organizations is doing. I certainly have learned a lot today, and I also want to thank everyone who attended and participated in our conversation. I do want to mention that there will be a 3-question poll that will pop up on your screen, or you can go to, it looks like www.untitled menti.com. So if you could please complete that, that would be helpful so that we could get some feedback on the session today. And with that, I'll just, say thank you again. I'm just in awe of the really innovative strategies that each of the panelists discussed today, and excited to continue to work with you all in the next COP year. So thank you.